Welcome to Nashiman News with Rizwanasi. Today being a Doctor's Day, I have come to Dr. Iftekar, who's been serving the people since more than 30-35 years, and there's always rush here. Other than a doctor, he's the man who cures people with his words. So today on Doctor's Day, I've come here. So what's your message?
Thank you very much for asking me to talk on the Doctor's Day. I am very grateful to my colleagues, my peers, for having contributed their services during this lockdown period and during the crucial moments in our life history. Probably we have not seen such pandemic, things that have erupted, but one has to face it, and to our best endeavor, all my colleagues, my juniors are doing their best to see that we render our services to the community and to the humanity at large. This coronavirus, Covid-19, which has struck all over the world, has been a major challenge for all the doctors and especially the public as such, where they have been asked to restrict their movements. I know they are going through hard times, but there is no other alternative but to take preventive measures. This coronavirus can be defeated by simple measurements, where more than the doctors, the people have to take their own precautions. We are here just to show you the road, but you are supposed to walk on the road. And for that, please listen and take advice from the doctors. We are doing this in your interest, not for any other trying to help the companies or trying to sell the medications. No, it's not like that. Please try to understand that this was started 3 months back in India, and earlier than that it was in China and in the Western countries. And even now, it is on rampant in the United States. And I'm sure what they have given the guidelines, we are following that, but considering our own Indian scenario, it's slightly different from what it is abroad. For instance, they say people over 65 are more liable for the attack on these people. But when you consider 65 years of age, in the Western countries, people are more healthy. They take better precaution where nutrition is concerned. But in our country, I would consider that anything over the age of 50 is prone and liable to get this kind of disease. And once they do get this disease, they succumb. So, but if you see the world statistics, the death rate is only 2%, and this 2% is on the elderlies. We have rarely come across the younger generation who have succumbed to death because of this thing. But the problem here is why the younger generations get involved in this disease and why they succumb to death is because of their habits. Now, earlier as it was told, who are the people who usually get into these problems? Age we have discussed, that over 65 in the Western countries, but here in India, I would definitely say over 50. One. Number two, it's the bad habits, where people are smokers, alcoholics. This is the condition where it really spoils your lungs. And why we talk about the lungs is basically, if you consider why this disease comes, once the disease attacks, it harbors around your throat, and from there it gets into your lungs. In the lungs, you have a small cilia which are continuously vibrating and trying to throw the mucus out. In this disease, this cilia gets diseased and they are unable to throw the mucus out. Thereby, this mucus gets plugged into the alveoli they, and once this gets plugged in, they multiply, whether it is virus or bacteria, it gets multiplied into infection, thereby leading into hypoxia. Hypoxia means oxygen and carbon dioxide transfer is hampered because already this alveoli gets plugged up. Not only there is one more study in the US which has said the younger generations who's between the age of 40 and onwards, they have started suffering from stroke. So this is a multi-organ disease where we are yet to evaluate what all the organs that can get damaged. We are talking about stroke, we are talking about liver problems which are also arising because of this corona immunity.
Pneumonia.
So and because of this pneumonia takes place. Now the only people who really escape are the people who have good immunity. How do you get the immunity? One must exercise every day for 1 hour. It is compulsory. Either you do the jogging or at home you can do your physical exercise. Healthy eating, don't go out to the restaurants and eat. Most important is now when the basic rules, start wearing a mask, keep a distance from the other people. You don't have to shake hands, you can just say hello from 5 feet, 6 feet. Doesn't make much of a difference, and avoid contacts. Stay at home and stay away from the disease. Any minor infection you get like throat ache, fever, anything, please consult your doctor immediately. Don't have to get panic that it may be there. The doctors are there to decide whether you have the disease or you don't have the disease. Wash your hands regularly. Any contacts on anything, make sure that you wash your hands properly. As you go home, make sure that your shoes and all are stepped outside. And the best way to prevent those who are working, as you go home, the first thing you can do is take a shower. So that these things, the virus can be in your hair, on your clothes, everything. Remove your clothes, throw them out for a wash. Make them sure that you dry them in the during the sun, or if the washing machine is there, they heat it up and they clear up the thing. So when you bring things, buying things from outside and all, make sure that they are kept outside for a few minutes. Sanitize them before you take it home. These are the simple measures for your own prevention and protection. Please make sure that you help the doctors more than doctors helping you. And the best message that we can give is, like we said, prevention is better than cure. Make sure that you are staying away from this. Children are not going to school. It's very good keeping them in the house. Don't let them go around and playing around in the playgrounds and other places. And as much as you can see that you avoid contacts, it is better for you. Should there be any problem, the doctors will take care of them from there onwards. I wish all of you success. Please stay healthy. Please stay safe. Make sure that your lifestyle is good. And one message I would like to give it to all the elderly is, please take folic acid 5 mg every day, because this makes your cilia in the lungs stronger and it will make them act more actively to see that your mucus is thrown out. So multivitamin, folic acid and calcium, vitamin C is a must. For vitamin C, you can also take 1 or 2 glasses of orange juice every day. Orange juice or citrus, any citrus fruits and all is good for your health. Please continue taking that, and I wish everybody a healthy life. Thank you.
So doctor has today told on the Doctor's Day the pros and cons and how one should protect